I'm Dawn Laguens. I'm the Chief of Global Strategy and Innovation for Planned Parenthood Federation of America. Just a couple of words about, well, my pronouns are she, her, and for those who might be watching who are trying to visualize me, I am a middle-aged, I like to generously say, white woman with gray streaked brown hair, blue eyes, red boots, a 1973 Pro Row t-shirt, and a very snappy chapeau because it's blazing hot in Austin today. So, Planned Parenthood, our 49 affiliates, and Dr. Dermish will tell you about her affiliate in just a minute, collectively provide the largest amount of sexual and reproductive health care in America. Every year, over 200 million people come to and through our digital ecosystem. That includes our websites, our award-winning period tracking and fertility app, Spot On, our chatbot, Rue, for young people, our chat text and our chatea texta in Spanish language, and also we have telehealth and also PP Direct. So check those out if you're looking for any kind of services or information. And I'm joined here today by Dr. Amna Dermish, and she is the Chief, and this is a long title, Chief of Medical Services and Operating at Planned Parenthood Greater Texas.
Right, yes. It's a mouthful.
So
it's a big job.
Tell us about Planned Parenthood Greater Texas.
Yeah, so Planned Parenthood Greater Texas is the biggest affiliate in the state of Texas and one of the largest affiliates in the Federation. Our service area includes 2/3 of the state of Texas. So we have health centers here in Austin, Waco, the Dallas-Fort Worth metro area, Lubbock, El Paso, and then Paris and Tyler, which are in the northeast portion of the state. And so, you know, Texas is a huge state, and there's a lot of areas to cover. You know, we provide a lot of really important care in those communities. Birth control access, STI screening and treatment, gender-affirming care, UTI treatment, HIV testing and PrEP medications as well for prevention of HIV. You know, we're constantly reaching out to our community to figure out how we can serve them. You know, obviously there's a lot of challenges being in a state this large, and we can't have, there's a lot more communities that don't have Planned Parenthood health centers than communities that do. So that's where we really lean into those innovative spaces to say, how can we meet our patients where they are? How can we make sure that they can access the expert health care that Planned Parenthood provides?
Well, it seems like right now we're talking about a kind of, especially when we look through that innovation lens, a kind of best of times, worst of times, because we have more and better contraception than we've ever had before in the history of the world. Mm-hmm. We have medication and surgical abortion that's safe and ready to help at any stage in pregnancy. We have so much great investment in femtech. We were hearing earlier about the amount of finally research actually done with women, for women, right? We've got an expansion of gender-affirming care, all of that. And we've got that little thing in your pocket that's got a doctor in it and a nurse and all kinds of information 24/7. So that all seems amazing, and yet, despite all that, here we are sitting with nearly 20 states having banned or seriously restricted abortion. Mm-hmm. We've just had a ruling coming out of Texas where teens are having some of their access to contraception constrained, so they can't get contraception that is life-changing and life-saving for so many young people. We've got attacks on our trans community, again, coming out of here and many other states, and the ability to get care, gender-affirming care. We've got people who say, we don't want you to be able to have books or get information or use your First Amendment rights to tell people how to get theirs. So it's kind of a crazy and but kind of time.
Right.
You're right here at ground zero. Tell us what it's really like as you try to give care. And then also, how are you all leaning into innovation?
Yeah, I mean, I think you completely nailed it. We have made so many advances in medical care. We have so much more data on safety, efficacy of all sorts of treatments, from contraception to gender-affirming care. We have the capacity and the expertise to provide that care, and yet we are fighting against attacks that are preventing people from accessing it. And it's at the point where, people can't even get information. They're trying to block access to information. So, our role as a provider in the community is to sort of break past those barriers, to sit with our patients, to provide them the information so that they can make the decision that's best for them. We're firm believers in shared decision making. We have the medical expertise to share with our patients. They bring to us their expertise in their own lives, their experiences, and we can help them make a decision that's best for them. But again, we're constantly fighting these external challenges that keep coming, and that's where technology and innovation really help us break past some of those barriers. The information is out there. How do we make sure that patients can access it despite what their local legislators might be trying to do? So that's things like the chat text line, where anybody can chat live with one of the Planned Parenthood health educators across the nation. Our own health educators at PPGT participate in it. It's things like Rue, which is the AI bot that can answer questions about sexual and reproductive health. And then within our health centers, within our affiliate, it's leveraging telehealth video visits so that you can chat live with a healthcare provider over a video visit, get access to care instantaneously. And then the Planned Parenthood Direct app, which is an app where you can get birth control prescriptions. If you have a UTI, you can get access to UTI treatment. And really, so we're looking at how we can expand those services, make sure people are aware of them, so that we can get to them.
That's great. Can you give us, I know you all are, I hate to concentrate on the heartbreaking, but really, Texas is a gigantic state,
Yes.
right? And the distances and the folks and the stories you guys are hearing and having to say to people, we can't give you the care we used to give you.
Right.
Can you just tell us a little bit about what people are facing?
Yeah, it has never been easy to access reproductive health care in Texas, certainly not in the 10 years that I've been in this state. It's just been a series of attacks that really culminated in SB 8, which was the bill that passed in September 2021, which banned abortion at the time that fetal cardiac activity could be detected on an ultrasound. We had patients driving 6 hours to come to our health center only to have an ultrasound and find that there's cardiac activity and they're no longer eligible for an abortion in the state of Texas, and you have to turn them away.
Yeah, that's so hard.
And knowing that they've used their resources just to get there that day. And it's just the hardest thing that I've ever had to do as a provider.
Yeah.
And since the complete overturn of Roe, you know that you see a certain percentage of these people in your health center, and there's so many more out there that aren't even able to get to us. So again, it's really how can we make sure that people can get access to that information that they need, that life-saving information, so that they can take control of their own lives, make that decision that feels best for them.
I was looking up the other day that Dallas, Texas, the closest health center that people are going to is 541 miles away in Overland Park, Kansas. So, you just have to imagine what that means, not only for how do you get there, how do you pay for it, you've got a job, how do you take off that time, you've got kids already, most people who have abortions are already parents, they have to then find childcare, so it's really just brutal what's happening to people on that front. And again, it's not limited only to attacks on abortion, it's to all kinds of reproductive health care. There are right now cases in front of a judge in Amarillo, Texas, 2 of them that we're waiting on. One is about mifepristone, and where they're going after the FDA, and that will impact people well outside of states like Texas or Florida or others that are working to ban things. That will actually impact, if it were to take place, that ruling were to be an adverse ruling, that would impact every person in America who's seeking medication abortion. So that's something to really pay attention to.
A lot of these things start in Texas, but they don't end here.
Yeah.
It doesn't stop at our borders. And we're seeing that, again, more and more. Texas has been on the forefront of these terrible laws, stripping access to reproductive health care, stripping access to information, stripping access to abortion, to the right to make our own decisions about our own bodies. And now, we saw it with the fall of Roe, with the Dobbs decision, and now we're seeing it with this potential Miffy decision. And I think, none of us can rest easy no matter where we live right now.
Yeah. One thing I read yesterday that was just terrifying, because everyone kind of says, well, people can get it and it doesn't seem like anyone's going to jail or whatever. Yesterday in Houston, a suit for $1 million was filed against 3 women for aiding and abetting one of their friends accessing an abortion that she needed. So if we don't think this is real, that's more evidence that it's coming on. I can say nationally, some of the things that we are trying to do on the innovation front, in addition to the products and things that we already have, is to make sure that we are making things, kind of smarter, faster, cheaper, less friction when you're looking for something, especially, again, if you're trying to figure out where you have to go and how long that's going to take and what costs are going to have. We're also working, and I know many of you all are tech leaders yourselves and founders and involved in the startup world. We're working now with, instead of only building things ourselves, working with amazing, particularly BIPOC, LGBTQ, female startups who are coming up with the products and services and experiences that fit right along with what Planned Parenthood is trying to provide. And I'd just call out a couple of them. I know you know Poppy Seed, which is a new doula-based accompaniment model for many things around reproductive health and life and parenting and all of the things, which we're working really closely with them because we think that's an amazing way of providing emotional care and support along the way. There's one called Piggy Bank, and that is one that's trying to consolidate. You can imagine when we talked about you're thinking about driving and childcare and all these things, and you don't have a lot of resources. They're consolidating all of the information about what financing and help you might be able to get. So doing that, and how can we pull those things in?
We live in an incredible age. I mean, there's just so much information out there. When I think about, when I was a teenager in the 90s, we didn't have access to this information. It was word of mouth. I mean, I told you this story, Dawn, a few weeks ago. When I was in high school, what they said is if your period was late, you take a really hot bath and you pour some vodka in it, and it'll bring your period on. That's the kind of information.
That was a big waste of vodka, I think. But,
you don't drink it, you put it in the bathwater. But that was the kind of information that I grew up with. And when you think about what information is out there, so we just need to make sure that people can be shepherded to the correct information, so that they know where to go to get that evidence-based information that organizations like Planned Parenthood are able to provide. And I think it's really, it is so disheartening to see these attacks continue to come. And I will say that this last year and a half has been the most challenging, both personally and professionally, in my life. But there is still a lot of reasons for hope, and it's seeing organizations come together to see how we can help. It's seeing how we're leveraging technology to make sure people can access information. That keeps me going.
Speaking of, just as we're wrapping up here, everybody's been experimenting, having fun with ChatGPT, and we know what AI can mean for healthcare. There was just some data yesterday that came out that showed how AI is going to be just a game changer in seeing breast cancer earlier than a radiologist can, right? It's going to revolutionize so many treatments. But I went in and decided to ask the ChatGPT a question. I thought you'd enjoy this. I said, which organization could best provide ChatGPT with a data set of correct answers around sex education topics? And the answer was, Planned Parenthood would be an ideal organization to provide ChatGPT with a data set of correct answers around sex education topics. They provide comprehensive, accurate, and non-judgmental information on a variety of topics related to sex and health. And you know, that's where ChatGPT is actually very smart, because it agrees with the vast majority of Americans that Planned Parenthood is a great organization, that people deserve access to the full range of reproductive health and rights, and it shouldn't be constrained by your race or your zip code or your gender identity or anything. So I would like to put in a plug that if anyone from OpenAI is watching us at this moment, I'm available. Reach out. We're going to help you get this right. And I know that Dr. Dermish wants me to tell you, please come to Planned Parenthood for care.
Yeah.
It's the best care. It's been serving women and all people for over 100 years, and you absolutely are not displacing someone. You are helping someone when you are a Planned Parenthood patient. We're just going to ask the final thing. What do people need to do in order to get involved, to help? Maybe you could just walk us through this slide real quick.
Yeah, you can come visit us at the Planned Parenthood Cafe at the Cap Metro Plaza. It's today until 6 p.m. You can also text South by Southwest to 22422 for more information, and just get involved, get out there, come see us for healthcare. We're the experts. We want to share our information with you. Please come and see us, but you know, get involved in your local Planned Parenthood organizations, donate, volunteer. If you're here in Texas, we have our lobby day coming up on April 14th. We would love to see you there. We'll provide training ahead of time. If you're not based in Texas, reach out to your local Planned Parenthood. Find out when their lobby day is. We can't stop. We have to keep going now more than ever.
Thank you.